Hello, today we are here in the fear of corona. We'll continue our studies and let's focus on the Norma basalis. This is the human skull and this is the base of the human skull where view is called as Norma basalis. So there are some foramens in the base of skull which are very important, through which some important structures come out. First of the foramen is the incisive fossa, through which the sphenopalatine vessels and nasopalatine nerves come out. Next in line is the greater and lesser palatine foramina, because this is the palate. This is the greater, names are very indicative. Greater and lesser palatine nerves will come out through this. And then we move on to one more foramen. This is having a lacerated margin, so it is known as Foramen Lacerum, and structures coming out is the greater Petrosal nerve, and in line with this is foramen oval. As this foramen is oval shaped, everybody very commonly asked in the exam, foramen oval. So the mnemonic here is male, mandibular nerve, accessory meningeal artery, lesser Petrosal nerve. Here is the lesser Petrosal nerve and emissary vein. In this we have seen the greater Petrosal nerve passes. So in next to this is foramen spinosum, through which the middle meningeal vessels will pass out, and also the meningeal branch of the mandibular nerve. And in next to this is the carotid canal. This is oval opening, so carotid name itself tells you that the internal carotid artery and carotid plexus will pass out. Going back to this, some small foramina are there, important of which this is the styloid process and this is mastoid process. So in between this name indicate stylomastoid foramen. From this, the very important nerve, the seventh cranial nerve or the facial nerve, passes, and we will focus on to the biggest foramen of the skull. This is the foramen magnum. Everybody can locate this foramen easily. So important structure passing through is the spinal cord, vertebral artery, medulla oblongata, along with vertebral venous plexus. So in line again, in front of that is the hypoglossal canal. Hypoglossal canal, obviously it will carry the hypoglossal nerve, which is the 12th cranial nerve, and also one more is remaining. This is the jugular fossa. Actually, jugular fossa, jugum means the neck, and it will lead into the jugular foramen. So jugular fossa, in line 9th, 10th, 11th cranial nerve will pass through this. We have seen the 12th cranial nerve or the hypoglossal nerve coming out through the hypoglossal canal. In just next to this is the hypoglossal canal, and just nearby the 9th, 10th, 11th will come out through the jugular foramen. So these are the important structures in a nutshell. We'll see you later on. We'll carry on these videos. Thank you very much.